This is Radio Health Journal. I'm Nancy Benson. This week, a beauty guide for women with cancer.
Let's face it, listen, you're still living. You want to look good. You want to have a sense of control and kind of feel like yourself.
A guide for looking pretty when you're pretty sick, when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Identity theft is a crime where you are presumed guilty until you can prove yourself innocent.
The lifelong burden of one family's secrets. Then,
probably couldn't have got through college, much less medical school if it wasn't for music.
We speak with two doctors who turned their love for music into a second career. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Cancer is a devastating diagnosis. All kinds of thoughts about life and death and the future could race through people's minds. But oncologists report that the number one question women ask when they receive a cancer diagnosis is not, am I going to die, but is my hair going to fall out?
That points to such a concern for women that I'm facing this horrible disease, but am I going to lose my identity?
That's Caitlin Kiernan, former fashion columnist and beauty director, and author of the book Pretty Sick, a beauty guide for women with cancer. She says she asked the same question, too, when she learned she had breast cancer.
I was told I was going to lose my hair, but not only was I going to lose my hair, I was going to lose my eyebrows, my eyelashes, my nails. A lot of people don't realize that with Taxol type chemo protocols, you can lose your nails or your nails can lift. And I'm like, how am I going to maintain my job as a beauty director and go out to events and beauty and meet with beauty people and experts and interview people when I look like I'm, when I have one foot in the grave? My career and my health were on a collision course. And I'm like, how am I going to rectify this?
As a magazine beauty director before she had cancer, Kiernan says she never provided beauty tips for cancer patients in her column because it just wasn't a sexy topic.
I do feel like there was a lack of information for women on the aesthetic side in cancer treatment. And I do feel like oftentimes, and this is what I experienced when I was going through treatment, when I would ask about my breast reconstruction or ask about my hair or my nails and how to keep those things looking good during treatment. Because let's face it, listen, you're still living. You want to look good. You want to have a sense of control and kind of feel like yourself. I do feel like I got a little attitude from people sometimes. I think there was judgment that I should be focused on my health and not on what my nails look like, or if my hair was going to grow back in a certain amount of time, or if my reconstruction was going to resemble real breasts. And to me, I feel like the two are not mutually exclusive. You can care for your health, but you can also care for your looks, and you should, because that's what helps you power through the day.
Kiernan says concerns about looks aren't trivial or vain. Often those worries are surprisingly practical. Some women want to look as normal as possible so they don't frighten their children with a bald head or green-looking skin.
Everybody has their own reason. You may be a woman that's a high-powered executive, and you have to walk into a boardroom and talk to your board of directors and be able to have confidence. And one doctor that's in the book is actually a breast cancer survivor, Dr. Heidi Waldorf. She's a leading dermatologist in the U.S. She was also a breast cancer survivor. She's like, I had to look good because I didn't want my patients to be like, are you okay to work on me? There's a lot of reasons why women going through cancer treatment want to maintain their physical appearance. And it's not just vanity. And I thought it was time to sort of shatter that taboo.
So when Kiernan received her cancer diagnosis, she turned to her contacts in the beauty industry to get the information she needed. For example, Ted Gibson, an A-list celebrity hairstylist who has worked on people like Angelina Jolie and Deborah Messing.
When I was getting ready and prepared to start my chemo protocol, I called him and I was like, all right, here's the deal. Like, what do I do? And he was like, you need a game plan. First of all, you need to go wig shopping because the wig specialist is going to need to see what your hair looks like, the texture of it, the color of it, so that we can either get you a wig or have a wig made that looks like your hair. Secondly, you need to cut your hair because within 14 days of starting chemo, your hair starts to fall out, and it falls out fast and furious. It starts coming out in clumps. It's on your pillow, it's on your clothes, and it really is a very disconcerting situation.
Next, Kiernan spoke to dermatologist Dr. Heidi Waldorf, also a breast cancer survivor.
She gave me amazing tips, just not only about skincare and taking care of yourself, but she also had really awesome tips about how she tweaked her makeup, after her eyelashes and her eyebrows fell off. Like, one of the tips that she told me was that she went out and bought these really cool sunglasses and eyeglasses and had the optician put in little pads on the nose. So it raised her eyeglasses up a little bit. So it covered where her eyebrow was. So most people didn't even know she didn't have eyebrows during that time. And she was like, when I went in to see patients, it just made me look like I had more authority, that I was kind of like more geek chic. And I thought, wow, that's just so genius. Like, who would have thought about that?
Kiernan says the experts in her book talked about things that aren't mentioned in the oncologist's office, including sex.
90% of women that go through chemotherapy, treatment, and radiation will experience some form of sexual dysfunction after cancer treatment. Not one of my oncologists said to me, you should be meeting with your gynecologist. You should be finding out about this. This is what's coming down. Nobody. And I was at the best institutions under the best doctors. So if I'm not being told, what's the woman in Alabama or Kentucky or in more remote areas than I was in New York City, what information is she getting? Like, to me, why isn't anybody talking about this? This is important information. This is life altering. It really has a major effect on your quality of life. And it doesn't just affect us, it affects our partners.
Kiernan understands that getting glammed up when you're undergoing chemo isn't for everyone. Even under the best of circumstances, it's a hard road.
When you're dealing with things like breast cancer or cancers that you are required to have a chemotherapy, that you lose your hair, there is so much of basic cancer treatment that makes you lose your femininity step by step by step. Surgery cuts your breasts, you have your breasts cut into or removed. You lose your hair, your skin starts to break out in acne. A lot of people don't even know that like cystic acne becomes a thing during chemotherapy. And you want to feel like a woman. You're losing such essential things that the little things really end up making such a huge difference in your self-esteem, how you're feeling about yourself, keeping a positive attitude. The little things get you through the long game, in my opinion. Listen, I'm not telling you to put on eyeliner. I'm telling you, if you're going to do it, here's the best way to do it. Or if you want to find a wig and you want to wear a wig every day, then here's what you should look for. But by no means should you feel like you have to do it. It's too much. It's too much.
With the whimsical illustrations and girlfriend feel of the book, Kiernan hopes she can help women who are cancer patients forget for a moment the horror of the situation. You can learn more about Caitlin Kiernan and her book, Pretty Sick, by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
It's National Alzheimer's Disease Awareness Month, as well as National Family Caregivers Month. The two go together since there are more than 16 million families and friends in the U.S. caring for someone with Alzheimer's. According to the Alzheimer's Association, 4 out of 5 caregivers say they'd like more support in providing care, especially from their families, yet 39% haven't engaged others in caregiving tasks. Ruth Drew, Director of Information and Support Services for the Alzheimer's Association, has suggestions on ways to help.
Make a standing appointment to give the caregiver a break so they can run errands or go to a support group. Caregivers often feel isolated or alone, so check in with a phone call or stop by for a visit. And when you offer support, be specific. Say, I'm going to the store. What do you need? Rather than call me if you need anything.
People overwhelmingly agree caregiving for someone with Alzheimer's should be a group effort. Find more tips and resources for caregivers at alz.org.
According to the American Cancer Society, prostate cancer is one of the leading causes of cancer deaths in American men. That's why, for men with prostate cancer at risk of progressing, monitoring for signs of progression is critical.
I'm Dr. Chris Pazanka, a urologist at Associated Medical Professionals in New York who has been paid by Janssen Biotech as a spokesperson. Men with prostate cancer, whose disease progresses after treatments like surgery or radiation, may receive hormone treatment to lower testosterone called androgen deprivation therapy, or ADT. However, for certain men, prostate cancer can further progress despite this treatment. Prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone, or ADT, is called non-metastatic castration-resistant prostate cancer, or NMCRPC. Men with NMCRPC are at risk for the disease spreading to other parts of the body. Erleada, also known as apalutamide, is a prescription medicine used to treat prostate cancer that has not spread to other parts of the body and no longer responds to a medical or surgical treatment that lowers testosterone.
In a clinical study, the median time men on Erleada lived without their prostate cancer spreading was 40.5 months versus 16.2 months. Erleada is not for use in women. Use birth control during and for 3 months after treatment with Erleada because it can cause harm or death to an unborn baby. Erleada may cause serious side effects, including heart disease, falls and fractures, and possible risk of seizure. Call your doctor right away if you experience chest pains, sudden loss of consciousness, or a seizure, and go to the nearest emergency room if you get chest pain or discomfort. The most common side effects were fatigue, joint pain, rash, decreased appetite, weight loss, high blood pressure, hot flash, and diarrhea. Tell your doctor if you get a rash. These are not all the possible side effects. Tell your doctor about your medical history of heart disease, seizures, stroke, brain injury, or tumor, and all your medical conditions. If you're concerned about your prostate cancer spreading, ask your doctor about Erleada. For more information, please see our ad in Popular Mechanics. Call 1-877-546-3586 or visit www.erleada.com.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It's not only about how well they can do their job and shoot at the target and use force when needed or not. It's also about their stress, about their sleep, their food, and those kinds of interventions are missing.
How do we help America's most sleep-deprived profession, law enforcement?
Then things to consider when it comes to pet food.
Obesity affects up to 2/3 of dogs and cats that present to their veterinarians, so it is the most common nutritional disorder that veterinarians are faced with on a daily basis.
All that and more on Radio Health Journal.